Hey everyone, it's Dr. Ahmad Al-Hassiny here from the Institute of Digital Dentistry, and this is another episode of the Digital Dentistry Decoded podcast, the podcast keeping you in the know. We've talked to some amazing people from basically all the main digital dentistry companies, and we are back again with another amazing person. This is Jordan Reiss. How you doing, Jordan?
I'm doing great. Thanks for having me on. Pleasure.
My pleasure, my friend. Thanks for jumping in and giving us your time. Now, for those who may not know, please introduce yourself. Please let us know a bit about you, your background in dentistry. And Jordan is from Dexis. So it's a company that's out of the limelight, I would say, in terms of digital dentistry. A lot of the bigger companies like 3Shape have been, and Medit and PrimeScan and all of that have been attracting all the attention. But you guys have been working on some amazing stuff. So please go ahead.
It's funny. I was just saying to someone else, I think we do a great job. We're number one in market share in the United States, in the CBCT market, in the intraoral sensor market, and the portable handheld X-ray market. And we're not so great with getting the word out. So I don't want to say our marketing's bad, but we're focused more on those solutions than we are on getting the word out. And we've changed our names a bunch of times, being part of Envista. So who am I? My name is Jordan Reiss. I'm Senior Director of Clinical Strategic Development for Dexis. And my journey and history is I joined the dental industry in 2003, coming from management consulting. And I joined in and was selling orthodontic products. It was for another one of the big companies out there, and ended up selling 3D. And I just kept asking, how do they know how to use this? How are they understanding all of this technology? And I wasn't getting great answers. So I just figured I would learn it all and attended every conference I could, and have since been in sales, marketing, training and education, R&D, product management, all over. So I've gotten a lot of different views, and I feel like I really do a great job of bridging the clinical along with the business need there across various specialties in dentistry.
That's cool, man. You said 2003. That's 2 decades. That's crazy, man. That's longer than I've been a dentist. So you got more experience than me, at least. Now, in terms of your experience with dental industry, did you get into the dental industry through Dexis, or how long have you been with Dexis?
So I've been with Dexis for 5 years. And I actually joined some other companies. I was with Carestream Dental, Orbit Imaging, Dimensions Imaging, Ortho2, a few of them, but really spent most of my time at Carestream Dental focused on 3D imaging. All of my focus throughout all of it has been in diagnostic imaging, hardware and software. And that's my area of expertise. So maybe I've been doing it for longer, but I definitely don't have the breadth of expertise outside of the area of diagnostic imaging. That's just my wheelhouse there.
That's super interesting, man. And I assume, does intraoral scanning fit into this, or is it mainly like CBCTs? And of course, we're going to talk about DTX Studio, which is super cool. And I think it's something that a lot more people should know about. But did you deal with a lot of intraoral scanning? I mean, I assume with Carestream Dental, it was also CBCTs, or?
Yeah, so back when I started at Carestream Dental, it was called PracticeWorks, and it was being bought by Eastman Kodak and became Kodak Dental Systems and was switching names out. When I joined, there was no 3D imaging. If you think about it, the ICAT, actually this month, is celebrating 21 years since getting first FDA clearance. And that was one of the top 3 units to even do 3D in dentistry. So intraoral scanning did not come along and become nearly as popular as it is till much later. So we started with the large equipment machines, PANs and Cephs and intraoral sensors. The idea early on was info imaging, taking practice management software, which was relatively new, moving from Unix and DOS-based environments over to something called Windows, which is new to people. That's how long ago that was. And then bringing imaging into that and saying, how can I have that in one system? And that was info imaging. When we talk about DTX Studio Clinic, which came along a little bit later, the concept there was to bring intraoral scanning and CBCT, 3D imaging, together as the basis, and then bringing the 2D imaging, photography, X-rays, all of that for diagnostic workflows. So intraoral scanning is definitely a part of this, but hasn't always been. It's not been around as long.
That's so true. And that's amazing, man. You've seen the entire industry change many times.
Yeah.
That's crazy. And part of this is just to pick your brains. Now, I know I set you up and I told you, Jordan, we're going to talk about scanning. You've seen our podcast. I actually want to throw a curveball at you. Let's just take a little sidestep and talk about imaging, because it's actually it's part of digital dentistry, and it's a topic that I get asked about a lot. A lot of people ask me, how do I choose a CBCT? Because there's so many options out there. What's kind of your advice on that, if you don't mind me putting you on the spot like that? I mean, I can see you're super passionate, and I'm sure people would love to actually get a better insight on how to choose one rather than this is the one my friend has.
So I think it's really important when we look back and see those practice management software companies out there way back. It used to fill up the entire trade show of mostly practice management software, and has consolidated a lot. And I think we'll see that with the intraoral scanner market later on, but with CBCT also. So you want someone who's going to be there now and into the future. These large units are quite expensive. It's an investment to make. So you want to make sure that when you're purchasing something, you can sustain that purchase, both in use, in workflow, and then integration with what you're doing. I think image quality is extremely important, but everyone's going to tout that they have good image quality. No one's going to say, my images aren't that great, but, so they'll all say that's fine. Field of view, resolution, and then workflow. And I think you'll hear me resonate so much about, it's all about the workflow. First, it's about diagnostics, and then it's about the workflow of that diagnostics that you're doing. But when looking at a CBCT, you want to make sure that you're buying as much unit as you need, right? You don't need to buy a unit that's going to have the largest field of view if you're not interested in visualizing more than just the jaws. You don't want to see TMJ. You want flexibility to go from low dose to high resolution. And you want a software that's simple, easy to use, and integrated into these workflows. I mean, I can't stress that enough. Pitching DTX, back to that a little bit, DTX does so many of these steps for you of how you have to set up a 3D. So if you're looking at a unit, ask to see the scan in the software and have them walk you through your workflow, endodontic, implant, orthodontic visualization, because there's a lot of setups of creating that pan curve or figuring out where the nerve canal is or creating a virtual crown. All of this can be, very easy to see when you're on a PowerPoint slide, but seeing it in action, you can see a big difference from one solution to the next.
Yeah, I mean, amazing advice. It's like drinking from a fire hydrant here. There's so much to piece. On the field of view, what's kind of like the most common field of view, do you think, for, let's say, general dental offices? Because that's probably our biggest viewership is from general dentists and probably specialists, actually. But, digital dentistry pros guys, what's the common field of view they go for?
So the smallest field of view is usually a 4x4 or 5x5. So it's going to capture 4 to 6 teeth. Generally speaking, you're going to want to capture a single jaw or dual jaw, enough to visualize into the lower sinus. So an 8x8 is a field of view that allows you to capture dual jaw, but can knock out the third molars. 10x10 captures most everything, but on large patients, if you're looking at third molars or large patients, horizontally impacted, distally presenting third molars won't be visualized. So the way we created the OP3D, which has been updated with the OP3D EX that just launched in September, was to look at a panoramic radiograph and say, what are the measurements basically on a pano? And if you want to capture the condyles, it's about 9 centimeters of height by 14 centimeters of diameter to be able to capture that. If you want to see those, we've extended that by 1 centimeter up and 1 centimeter wider because it's a little bit easier to have more flexibility if a staff member is positioning to get all of that in there. So I would say the 10x10, to answer, is the most popular field of view, and then have some smaller ones from there that are available to you.
I appreciate that. And again, sorry to throw you a curveball. I know you're probably primed and ready to talk about DTX. One last thing about the CBCT stuff. So resolution, and you're totally right. Everyone says the image quality is the best, and you see stuff on social media, and some of them genuinely look amazing. Is there like a metric? I assume it's resolution. Is there like a resolution that you would recommend people don't choose under, or How does it work?
Yeah,
Objectively, how does someone,
it's a great.
figure this out? How do they figure out what is going to work for me?
Everyone puts up their best images, right? So when you go on there, who's got the best marketing out there and they put up these beautiful images. You want to see images also with realistic patients in there, crowns,
Like
scatter,
scattering.
right? Yeah, you got it, right? So if you're getting one of these and you're looking, show me a case with a full denture in there, someone who's got zirconia, someone who's got some metal posts in there, and you'll see there's scatter in there. It looks different than 2D. So back to resolution. If it's endo, you need a very high resolution. And the periodontal ligament is a good way to go. It measures about 200 microns. So to be able to visualize that, you need 100 micron resolution, half that or double that, so that you can clearly visualize those onto a single pixel. But it's not just the voxel size, which, by the way, is a portmanteau for volume picture element, voxel, because we all know pixels for picture element. But it's also signal to noise ratio, contrast to noise ratio. Those are things they put in there. Some even say MTF. But really, what you want to look at is get some scans, look at those more challenging cases of more restorations in there, and see how that company is doing with metal artifact reduction and their algorithms. Just like we'll talk about with scanners, it really matters the software. Everyone's going to say image quality, great, but when you get these, what can you visualize with this? How can it work? And the software can do a lot to clean up a scan, allow for shorter scan times, allow for edge preserving noise reduction. Some talk about scatter reduction. Some talk about movement reduction. With these, you want the patient to be firmly in there so they don't move. And you don't want a long scan time where they have the opportunity to move. And those are really as important as resolution. So going back to PDL, it needs to have at least 200 micron resolution for any scan, because we want to see the PDL space, orthodontists for ankylosis, implants for any concerns that could be around osseointegration. But again, take a look at those thick scans to really get the best.
Awesome, man. Look, it's amazing how passionate you are. And this is why I love talking to you guys. You guys are so damn smart. You guys know this like the back of your hands. And I think, the average dentist doesn't, at least with myself, I speak for myself, when I got into this game, you see the company guys and you think, oh, they're just company guys. But you guys are, this inside and out. And one last question about CBCT.
Yeah.
I know I said that for the last 3 times.
Let's do it. I love this stuff.
You think? Yeah, me too. I love CBCT. I'm a huge proponent of it. I think it's one of the best things that any office can have if they can fit it in. Do you think we'll ever get to a point? Because here in New Zealand, we're even still a little conservative with CBCT.
Yeah.
And I know in some countries in the world, if you take a CBCT, it has to be reported professionally by a radiologist. Do you think we'll ever get to the point where CBCT is the standard of care for new patients? Because I speak for myself and I can't count, it's countless times that's happened where I get a new patient exam and let's say we're planning an implant and I take a full CBCT and I'm like, oh, there's a gigantic periapical lesion somewhere. And there was very little chance of me picking that up on a set of bite wings or a panel. So do you ever think we'll get to that point where it's more accepted?
Yeah, it's a great question. It makes me think of so many different things that are going on, where the ADA came out with a statement about using lead shielding and not requiring that anymore. State regulations trump that. But I went to the Cleveland Clinic for, I thought I broke a finger, and they said, no, we don't use lead shielding at all when taking radiographs. So they're minimizing the scatter of it and understanding it differently. But at the same time, there's ALARA, as low as radiographically acceptable, or ALADA, as low as diagnostically acceptable. We want to minimize the dose. There's a great website for actually patients called radiologyinfo.org, and they show a dosimetry table from CTs down to dental, and we're very low there. But we've got to minimize this because patients are coming in multiple times a year, and we want to make sure we set the right standard for causing no harm, as we know, right? With this ability to visualize. Standard of care is actually a legal term. So I would say standard of practice might be better. The standard of care requires that it's accessible, that there's literature to support the usage, which we have, and that it's been tested legally in your local area. What was the one that someone brought up? I couldn't believe it, but I don't think the microscope is standard of care for endodontists when you officially put it up there. I think that was a true statement. Don't hold me to that if it's not. No endodontist get mad at me. Yeah. But I believe that that's to be a true statement, even though one would assume that you would use a microscope for endodontic treatment. But the point here is it needs to continue to be very low dose, and it needs to continue to be supported by literature where some units, the iCat for one of theirs has a full field of view that's the same dose as a Pano. That's very beneficial. Wow. It's a very low dose scan. It's not as resolute as what one would want for endodontists, but it does serve a purpose. The other area here is your patient population. The thyroid is one of the things that has a multiplication factor when it comes to dosimetry. And for younger patients, it's higher up in their neck, so it gets exposed more. They have a longer lifespan. So for your younger patient population, you need to be more careful about using x-rays than an older population that it's not deterministic, it's stochastic when they talk about radiation, how long it could be creating a greater probability of possibly cancer in patients. So again, it would be nice, but I think it's going to always be a component piece, a tool in the armamentarium, because intraoral radiography gives you a greater line pair per millimeter, is what they use versus pixel or voxel, than 3D. And because that sensor's right behind that tooth, it'll always be the de facto intraoperative visualization and for getting those quick views of like interproximal decay.
Yeah, it totally makes sense. And I guess, look, I know PA series or, intraoral photograph radiography series where you take all these PAs everywhere. They're not as popular here in New Zealand. I'll be honest, I didn't even train like that, but I know they're popular in the States.
Yeah.
Surely, because the dosages are going so low now with CBCT, surely the dose is it comparable to like a PA series, or is it just comparable to an OPG? How does it all work?
So it's hard to quote them all out, but I remember an article by Dr. John Ludlow, and he said D-speed film, FMX, full mount series, was 388 microsieverts. When moving to digital, it was 150 microsieverts. If you used a square collimator, you could get it down to 40. Sounds good, wow. But people start missing some of those. So you have to do retakes, right? Again, why we need the larger field of view with the OP3D EX. But the range for CBCT is usually under that 388 microsieverts, even for the large field of view, super high resolution, slower scan times, and can be as low as around 5 microsieverts for the super small field of view, very low dose. I've placed an implant and I just want to see in 3D, is it in the right spot? But not great for diagnostics, great for post-treatment visualization.
That's incredible, man. Yeah. Honestly, getting it that low. And when I think personally about how much information you get from CBCT, I mean, seeing things in 3D compared to 2D, there's just no argument there. But that brings us to... Sorry, go ahead.
No, just with that, what I like to say is when you use 2D, you're getting 2/3 of the information. You're getting 2 dimensions. And with 3D, you get 3 dimensions. So this ability to cut through the teeth in an axial or cut through the anatomy you need to see and move that to any angle you want just blows me away, because even in medical, they don't have the software we have in dental to change up these angulations, to do these pan curves, to run down the long axis of a tooth. And when you show someone in medical what we do with CBCT, they're blown away by the resolution and the software. It just doesn't exist in that market. So sorry to interrupt. I just,
No, not at all. Please, I love it. That is actually crazy. And also, we're super fortunate in dental that we just, you want a CT, you just go, hey, patient, go into that room. We're going to take one, versus like reporting. And even though there's a whole thing to be said about, maybe people overdoing CBCTs, is the education there? Do they know what they're taking? Are they diagnosing them? Anywho's, we could go down a huge rabbit hole there.
For sure.
Talk to me about Dexis, Investor. A lot of people
Okay.
kind of have an idea that you guys acquired Carestream Dental's imaging, not the whole Carestream Dental, just their imaging.
Just,
Did that
just the
include?
just the intraoral scanner business. We'll get in trouble if we say all of their imaging, but just their intraoral
Right.
scanner business.
Right. So not their CBCTs.
No, not at all.
No. Okay. My mistake. There you
Yeah.
go. I
Oh, good.
educated myself. So you guys make your own CBCTs.
Yeah, absolutely. So Dexis has been around. I think we're celebrating 60, 70 years right there upcoming. So Dexis is an amalgamation of a few different companies. So we've got Instrumentarium, Gendex, Soridex, iCat, Nomad, just so many of these. So where the panos were created, the founder of that is back in Finland, and that is where we produce our units. The OP3D series. The iCat is made here in the United States. We're also producing the sensors, and then we have X-ray generators, and the Nomad is also here in the United States.
Cavo white label, doesn't it? Cavo white labels your ones?
So we were Cavo Kerr at one point, and we sold off our handpieces and treatment units to Planmeca, who now has the name Cavo in the United States, Cavo in Europe, which is Kaltenbeck Voigt is where it comes from. But they now have that name. We were branding our OP3D as a Cavo OP3D. That same unit is now Dexis OP3D because we don't use that branding anymore.
I had no idea, man. That's the CBCT that I use. That's the ones that we have in our practice.
Yeah. That's us. So
well, it's a great CBCT. I love the dev thing.
That's awesome.
I had no idea.
Yeah. So it's pretty wild, and other companies have gone through this where there's a lot of changes. So you mentioned Envista. We were part of Danaher, and Danaher is a publicly traded stock that's in so many different industries, but they broke off the dental business to become Envista. And those businesses under it that I think, it's like the first rule of Fight Club. Don't talk about Envista, talk about the businesses, even though we're starting to more. Those are big names: Nobel and Implant Direct, Ormco and Spark, Oroscoptic, and just so many more. And Dexis is, of course, one of those companies. But those are all these brands that are underneath this one model that helps us to use what we call Envista Business Systems to really standardize what we do and sustain the learnings that we have, and then really help our customers. So it's an impressive system, and it's one of the main reasons I joined this company was because of these systems really help us to provide not just today, but into the future, the right needs for our customers by listening to them and hearing back what we think is working may not be what they understand is working. And we're very quick to change and help out our customers. What you're seeing with change in the intraoral scanners that we purchased from Carestream Dental and with our software, DTX, lots of updates. That's
super cool, man. And it's interesting that you found a lot of positive in the corporate sort of, I don't want to call it a takeover,
Sure.
but you know what I mean. Like, it's basically like a behemoth now, Investa Dental. It owns so many huge companies because some corporate takeovers and these models don't end up working so well. I mean, one example is a certain intraoral scanner company that got acquired recently, and they're having some hard times. So it's quite interesting that you've seen a lot of positive in this.
Well, I think that in a lot of those companies grow to a certain extent, or towards the tail end of what they're doing, they're looking to sell. And I think that what this concept is we need to provide a solution that reaches 80 to 90% of the market, that reaches the needs of ortho, implant, endodontic. We have, of course, our consumables with Kerr, all of those. And the goal is to fill in pieces. So even though we are a behemoth, right, a large company, I know and have access to so many people at all of those companies and feel that, they're part of our family. And it doesn't feel super corporate and big to me with what we do. It really feels like you can reach out and say, I'm having a problem in this area. Let's just call it manufacturing and make more sense. Let me go to a sister company and ask you, how do you deal with this problem in manufacturing? And they can provide you with that answer. And they actually bring people from those companies over to our companies to have something, what we're doing right now called a Kaizen, constant improvement. And they join together to come up with new ideas of how we can help each other. So that was really great. Getting so many people to join in and find solutions or show other solutions that have worked, how it might help your similar industry.
That's super cool, man. I mean, being able to tap into that much manpower and more importantly, probably hyper intelligent people, that must be amazing. So you were telling me you guys are killing it in the imaging department, CBCT.
Yeah.
Talk to me about scanners. Let's get into the good stuff. How is Dexis scanner doing in your side of the world? And I guess as a overall, say, vision for the Dexis scanners, what's the plan here?
Yeah, so we're not number one, right? You've mentioned some of these companies that went out there and some of them created partnerships with everybody, and some of them went to really low price, and some have specialized in the lab area, and they've done a great job. And we're coming to it a little bit later. So it's been an interesting time. We announced that we were acquiring the Carestream dental business of intraoral scanner business in December 2021 and closed in April 2022. Around this time, COVID was hitting, and dentist offices were being closed in some areas for periods of time during this. And then at the same time, we saw lots of market entrants coming in with very low-priced solutions, and then those that were the high-end ones were dropping their prices by as much as 30%. So it was an interesting period there of how do we bring this over? And one of the things as this is all going on is we are switching over to being all Dexis versus the brand names that you mentioned before. So there was a lot of challenges. And yeah. And then channel conflict. It was being sold mostly direct, and we are going through distributors. So it's some very good questions to ask and good problems to solve. And I feel like we've done a good job. When we brought over the Carestream dental business, the first thing we did was talk to customers and say what's working, what's not. And then we said, how do we envision this product? And I believe that, the answer to that is we envision it as a premium product with a mid-level price. And I think that's what we see with a lot of our products. They're very much premium products, but at a pretty accessible price. So one of the first things we did was hear from them that the software was very important. The 3800 wireless, for example, was launched during COVID, so there wasn't much fanfare. So we went in and really redesigned some of the stuff in there, but the most important was the ScanFlow software. They had premium users and standard users and some features that were offered, and we just made everyone a premium user right away. Those that had it, we said, you get all the features, don't worry about it. And then from there, we were able to focus in on one software. And I think you've seen it, that we've really done a lot of updates to that software to drive innovation, to put AI into the unit. We now have AI for scan body assist, soft tissue removal, AI matching, AI segmentation for shade matching reports, and really try to make the solution simple and easy, because you never know that you're using this AI. You can't see it. It's hidden in there just so that, you're getting what you want without knowing, the secret sauce, I guess it is.
Yeah, I mean, I actually just released a review on the scanner. To be honest, every scanner scans these days. It's not as impressive. It is all the software element, the integration. I kind of believe, look, that the Dexis scanners get a bad rap a little bit. And I don't know if Carestream Dental fumbled it a bit with the Carestream Dental scanners when they had it under their wing. I love the company Carestream. They do some good stuff in dental, but definitely in the intraoral scanner market, I feel like they just got rolled by everyone else. And definitely the software side was lacking. So it's really interesting to see you guys focusing on that. It's interesting seeing the talk of the town. A lot of people think you're overpaid for that scanner. I don't know if you know, but
no. Oh, yes. Yeah, sorry. For the overall price of it.
Oh,
right.
They overpaid. Yeah, they overpaid, and it's such a lemon. But honestly, I don't think it's that bad. I mean, you guys can really turn this around.
Right. What it was is, in my opinion, not the company line here, I hope it's okay, is we attempted with some other homegrown solutions and really tried to come out with some scanners, announcing at IDS many years ago, a solution, and it didn't really make it to market. We partnered with others and brought them in, and that was working okay. we really needed a foothold to get what we want, which is implant workflows in our control, so that we can really make it work. And we needed a solution. So the cost to do that in-house, in my opinion, would have been more, again, than that amount. And whether we overpaid or not isn't so important with what we can now do with all of the rest of our products. And you look at the grand scheme, that amount is pretty high that we announced that it was. But once you look into the future of how much that can offer, it's going to not be the worst decision ever. But boy, it certainly got a lot of attention. Yeah.
Yeah, it did, and a lot of jokes and whatnot. But like I say, I really don't think it's not like you chose the worst scanner on the market or anything. It was just a scanner that wasn't as popular. But I know a lot of doctors and some big KOLs out there. I mean, shout out to Rick Ferguson. I know he uses a Dexis or a Carestream dental scanner. He loves the thing. So there are people that like it and enjoy using it. I used it. Look, I'm not going to say it's the best scanner I've ever tried, but we'll get into the software play, which I thought you guys are doing probably better than anyone in terms of the data management, the AI, which blew my mind, because it's interesting. Even on the software play, it's like you don't really market it too much. I don't know if it's the marketing department. I stumbled across the new DTX Studio clinic like in Chicago midwinter. I just walked past the booth and I was like, what the heck is this?
Right.
And they showed me and I was mind blown. And it's funny. Are you guys just not going heavy into marketing right now because you're testing, or is it just the company is a bit more conservative? Or
I mean, there's so much going on during these periods of time. And again, DTX went from being something we were working on to something that we've really rolled out as this great solution. At first, DTX, which stands for from diagnosis to treatment, D to TX, right?
That's cool.
Was supposed
I didn't know. You didn't tell me, man.
Oh, everything's an acronym. Dexis, Digital Electronic X-ray Imaging System Software Solution. That's what that is for Dexis. So many of these are very interesting ones. But this ecosystem was supposed to be everything for everyone. And we slowly brought it back, realizing we want to have more of a focus. And that focus was a lot on implant workflow. But we wanted to roll this out slower. And again, looking at, getting the word out, a lot of companies announce things very early on and slowly deliver. Our idea here was we have a market, 165,000 users of our units out there of different products. I mean, it's amazing when we say how large we are. And we wanted to make sure that those customers were brought along with us. So our goal was to make this software work and work on premise in a single office really well. And then it was to make it so we could expand those features and functionality. And I think we've done it. Like, I think where we are today, we're going to continue to do more, but where we are today with the FDA and MDR clearances we have with the AI and the workflows, it's absolutely amazing. And we do want to get the word out more, and we're starting to do it. But over the last couple of years, the market was getting smaller, I think, overall in dentistry. A lot of companies that were out there were struggling. A lot of companies that I thought would be worth a lot of money recently sold for very little, surprisingly. One in lasers and one in practice management software. And we just wanted to make sure we right-size ourselves to be able to be there, again, sustaining for the future.
Yeah, man, look, and it's a tough market. Dental is not an easy market, especially not digital dentistry, I think. And especially on top of that, not the intraoral scanner market. I think it's, like you say, it's got to consolidate. Having over 30 players and the price is going down. I think I saw an advertisement the other day, $3,000 intraoral scanner. Crazy.
Well, I mean, the funny part is when you say like everybody can scan now, the first couple solutions couldn't scan for everything, right? Like there would be issues with just getting a scan. And now there's some out there and they're not able to do all that you need to do. A lot of that breadth and depth and that ease of use. They're cheap or inexpensive. And I think we've seen a lot of solutions that when you open up that fourth operatory door that's not being used, you can see them sitting in there, a lot of this, large equipment. And they're like, yeah, I don't really, So it's a question of inexpensive or cheap. For our intraoral scanner, I think one of the things that's unique about it is that it is part of this ecosystem, that it really opens you up to being able to do so much more across all of your computers in your office with all of your staff. It's so easy. That the scanner is so small that it's less scary, I should say, for a staff member to pick it up and start scanning. But one of the things that I think is so neat is I did it with my son. I handed him over the scanner and I said, "Hey, scan your mouth for me." And he said, "Well, what do I do?" And I said, "Well, watch on screen." And he literally at 16 scanned his mouth without an issue. And I was able to use it to build a night guard. So I didn't build it myself, but it was amazing. And I don't think with any other system that I've seen out there, hand the person the scanner and say, "You haven't scanned before? Go for it," that they can do it. I just haven't.
Yeah, it's super interesting. And definitely the ease, like every scanner can scan. I've used literally every single one. They all can handle scanning now. I find the big differences now are software, integrations, ease of use, somewhat. I think for like a crown scan, personally, they're all pretty easy. I don't know about a 16-year-old, but for a dentist, they should be able to pull it off. I find the big difference now is in edentulous scanning, handling blood, handling moving tissue. Even though, again, edentulous scanning and moving tissue, like for scanning implants, is a subset of dentists, I think for the vast majority who just want to scan a crown, they all work. And so then it becomes, what's your special proposition? What do you do different to the other 20 guys on the market? And I guess that's a good leadway to DTX Studio Clinic, because again, I think a lot of people have no idea what this is. And if you don't, I highly suggest you check it out. I wrote about it on my review.
Thank you.
But please, Jordan, let me know, how do you summarize this? I mean, to me, the most mind-blowing thing, guys, it's basically a imaging / data software / AI software / almost practice management, not quite. But the most mind-blowing thing to me was you dump all these X-rays, all these photos into basically the uploading screen. And then the software aligns them all with AI. That was so cool. And aligns them accurately, segments each tooth, and also somehow aligns the photos to each radiograph. And I was just like, this is crazy. And it's crazy that not more people know that this exists.
It's such a great software. It's a comprehensive, integrated imaging platform that's a central hub for connecting diagnostic and treatment, seamlessly bringing all that data into one unified patient chart. So what we've seen with most offices out there is they implement solutions slowly. They do a 2D, they do a 3D, they later on buy an intraoral scanner, and they have up to 5 different software programs in one office. And our goal was to create one where you could bring it all together and say, hey, put everything into one place for me. Now, what's so cool about it is you bring in a intraoral radiograph. Now, not just a Dexis or an IXS sensor image, but drag and drop the one that came from the referral into our software. It will recognize the teeth in that X-ray. It will file it away into your mount. It will automatically rotate it into the right position. And then it unifies it. So that's where, like, it's so hard to get this across. I talk about
without seeing it, it's hard, I know.
Right, it's so hard to explain. But once you have your 2D in there, you can load up your 3D. And again, you could drag and drop anyone's DICOM directly in here. With ours, you could acquire directly in, and there's some benefits, some extra filters, and it's great. But we're not stopping others. We're giving the power of choice to bring in your other BYOD, bring your own device. And then you bring in the intraoral scans also. The AI recognizes the teeth separately in the intraoral scan, separately in the cone beam scan, and also in the 2D radiographs. But once it's done that, because everything's in one ecosystem, what's so cool is you can click the space bar, point to a tooth in the 3D rendering, in a 2D radiograph, in one of the MPR slices, and click on it. And the AI will bring up on screen your 2D and 3D, take you down the long axis of the pulp chamber of that tooth, and you can click tooth by tooth to navigate through this data set because it's organized for you. So it's filing your images for you, allowing you to pull them up. And in the future, I think we'll be able to do more because we're having all of that data in one on-premise system that we can use that data to provide better solutions into the future, because we started this one later. with CBCT and intraoral scanning in mind, not just a SQL database, a data repository. This was workflow first, how we go about that workflow as the secondary.
And I understand that also for those, AI is all the buzzword now. AI this, AI that. You mentioned that to me, and when I was playing with it, it also does some AI diagnostics, kind of like Pearl. I don't know if you're allowed to name drop other companies.
No, of course. Why not? Yeah.
And also it does AI surgical guides. Are those things released or are they in progress?
So you got to see the surgical guides a bit early, but it is fully released. So the AI you're mentioning for diagnostics is with the 2D radiographs. It can detect caries, calculus, bone loss, margin defects, I think it was those apical lesions, root canal defects. For the surgical, let me run down some of this. So it can recognize that in the radiographs. So first the AI will automatically file the radiographs. Then it recognizes those findings and marks them so you can mark them for further follow-up. For the CBCT, the AI sets it up for you. So it automatically traces the nerve canal, FDA cleared. It will recognize and do the panoramic curves for you, the TMJ if they're captured, bring it down those. It will reorient the patient's head if the scan wasn't taken correctly to natural head position versus scan position, and you can go through those for yourself. And then if you bring in your intraoral scan, you can just click a button and the AI will fuse the pixels and voxels, the intraoral scan with the cone beam and bring those together. The AI will suggest a virtual tooth for you, making it biodiverse, looking at opposing occlusion, contralateral occlusion in teeth, and put one in so that you can do your crown down approach. And then from there, we're going to use the word automated, but it will suggest a automated surgical guide for you where you can do some revisions from it. So, and like you say, how do you explain all of this without seeing it in action and actually realizing how few clicks that is? It's not that many.
This is the future of dentistry, man. Yeah. What you guys are building is the future of dentistry. I had a really good chat with Rune from 3Shape, and we always say, the future of dentistry is one-click solutions. Just that's going to be what it is, where AI and amazing software combines all the data, and then it just proposes all of this for you, and it's just click, 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 and you get to work. It's incredible. And when I saw how much is built into the software, I was frankly shocked because I don't think any other, you guys are not just the intraoral scanner company, obviously, but definitely no other intraoral scanner comes with a software like this. Right. In saying that, you're not the first company to say we want to be the software where everyone's data is there. We've heard this a lot in the entire industry. Everyone talks about islands of software, and I totally agree. It's super frustrating, by the way.
Yeah,
I'm sick and tired of having 6 different softwares for scanners, CBCT, X-rays, practice management, notes sometimes. But I really, a lot of companies have talked about unifying this, and God, how are you going to me, the only way you unify this is integrations galore, because even though you make it drag and drop an X-ray, a photo, when dentists are seeing anywhere between 4 maybe to 15 to 20 patients a day, and they have to, drag and drop every single X-ray they take, it's not going to happen. It just won't happen. And I think this is where the hard part is how do you integrate with this volume of different X-rays with this, and how do you get a tech network globally that will troubleshoot all the integrations? Because to me, unless everything, when I take the X-ray for this to work, I want to automatically on DTX Studio Clinic. That would be ideal. And obviously if we all buy things under your umbrella, that's probably how it works. But for people these days, they have a combination of different devices. And do you have any thoughts about that?
Lots. So you're right. And again, it's about, smart growth. We can create, we have integration. So first of all, with 2D, we use Twain. Twain is, I don't think it's actually called this, but it's technology without an interesting name, is what they say the acronym for Twain is. I'm really into my
acronym really love today. Thing.
What's that?
You guys really love the acronym thing.
I do. Gosh, it's crazy. Sorry. going to slow down on my
No,
acronym.
don't worry.
Decoding, or digital dentistry is going to just be decoding acronyms for you. So,
Exactly.
but Twain is a boring technology that allows us to take just about any 2D pan, Ceph, or intraoral radiograph and seamlessly you can acquire directly in our software. The 3D is where it's a little bit harder. We have some integrations there, but we also have something called a watch folder. So when the output comes out of another solution, it can go to a folder and our system can watch that folder and grab it from that one and bring it right into our software. So you don't have to do all drag and drops for those. We do have integrations with practice management software programs throughout the world, not everywhere, of course, but with those, the practice management software opens the imaging software. And in some cases, it's a two-way integration. So the images go back to the practice management software storage for insurance and those things. And others, more simply, we have a one-way integration. It opens up our software and our images are now the de facto database. So those two are shareable. We have these APIs or ability to help another company that is in the market to be able to take advantage of those. The two-way is a little more challenging to set up. The one-way is not so challenging to set up. But getting these 3D ones, it requires a little bit more work because people want to own the desktop. The first step here is to make sure that you can import and also export in non-proprietary formats. And we do that. So we're not locking up the data or taking the data and holding it hostage. Whether you're on support or not on support, that data is yours. You can easily take any one of those scans, 2D, 3D, and export it in a non-proprietary format, the kind that almost, I don't want to say every, just to be careful, but I'd like to, software can open so that you can share it and that your collaboration team, your group that you're sharing with can take advantage of this, filtered or not filtered, multi-file or single file, STL or in color, PLY, those are all right there in the software. So yeah, you're right. What I think we're doing differently than some of those other ones that offer this is we're not trying to be the only one to do this. We just want to do it in a unique way that people who, offices that buy our solution get this and they say, I want to bring everything else in-house. And when we have those guys loving it, then others are going to say, hey, I want that solution. We say, okay, we can sell it to you, but if you buy our cone beam, our intraoral scanner, whatever, it comes along with it. Now we're making our products get that unique selling proposition that you're talking about. And that's a big benefit. And it's helping them because it's going to be less expensive in the long run, easier.
It's a genuinely cool product and solution. And I can't stress this enough. Anyone, I mean, look, this is not a pitch. Jordan didn't flip me $100 before the podcast or anything. Just check it out just for the sake of interest, because to me, it's just amazing. I love this industry. I love dentistry. I love practicing dentistry. And it's just amazing to see where it's going, because if you guys are doing it, I'm sure there's other players that are also crafting up stuff. But kudos to you guys, man. I haven't seen anyone pull it off like this. We've seen separate kind of bits of the puzzle.
Yeah.
We've seen the diagnostics by a single company. We've seen the segmentation on 3D by a separate company. We've seen all sorts of different companies doing different things, but to have it all in one software, that's where it really starts to sing. And that's where it really starts to be quite impressive. And like you say, the fact you just throw a cone beam in there and it segments everything, it traces the nerve automatically. It's like, this is how it should be.
Yeah, it's really great. You said, I think AI is like overused too much. The cloud and AI are two words that are really used so much, and they mean such different things to people. So to me, what's really important here is that it's not about AI. It's about AI as part of a workflow, as it benefits you. It's assisted, not artificial intelligence. I heard that on another one of your podcasts. I went, that's what I say. So I'm glad that others are saying it and others are coming up with solutions, because that's what competition's really about, right? Everyone comes up with these ones and each company says, we've got to make ours better, right? We've got to continue to strive to do more. So for us, this nexus of these things is really that productivity cloud is what I'll call this, right? So it's It's workflow productivity, and then in the cloud is where we're going to go. Is where we're going now, I guess I could say. When you say collaboration, some people say that's sharing data. Others say that's actually collaborating and using the same software. And others are just, I want to access the data. When you talk to a dentist or a staff or a DSO or a lab, they define all of it very differently. But for us, we want to come in there by doing all of those things and making it so it's simple. So you don't have to use, like you're saying, all of these various tools. Bring labs and staff and even patients into a sharing process that's easier to understand. And one example is we have this patient education tool we call Smile by DTX. It's so simple. Basically, after you place an implant, you can get a 3D rendering that rotates around that implant, and you can push a button. It creates a QR code so that the patient can go home and on their a phone or tablet or computer, they don't install software. They click on it, and it just does. It's like a GIF, and they can see it, and they could talk to their loved one or other decision makers about what's going on to help with what questions they may not even realize they wanted to ask, or better understanding or acceptance of that treatment plan. So yeah.
Oh, it's super cool, man. I'm being mindful of time here because I could speak to you for like 5 hours.
It's fun.
I love the chats with you. Always go away learning something, and you're so damn passionate about this.
Yeah.
But I will have 2 more questions. First and foremost, what's some exciting things we can see that you can share at least that's coming from Dexis? And I'll cover it in 2 ways. DTX Studio Clinic, again, you touched on it, but what's kind of more of the vision? What's some things that people may not, expect or be surprising, if you can share that?
Sure.
And also on the scanner side, because, you guys acquired this scanner. That's fine. It's a 3-4-year-old scanner. I think it's about time to update it. Maybe that's just me. But is there something coming up on the horizon next year, IDS, something like that?
Yes. So hopefully I'm going to actually be at IDS. So if anyone's watching this, come by and tell me that you watched me here, and we can have a great conversation. Absolutely. IDS is going to be an important one, and DTX is going to be the center of it. It really is about building upon this ecosystem. So leveraging more with our intraoral scanner solution through DTX is going to be one of the things you'll see. When we talked about DTX, we talked about boiling that down to implant workflows. So we talked about AI. Imagine, without giving up too much, that there were even less clicks to get you through those steps that I mentioned to where you can say, okay, all of this is done. Let me say I want this implant. Right now we have 4,500 implant choices in the software, and you are set up to where all you have to do now is tweak a tooth to get it into, so tweak an implant to get it into the right position, because the tooth has been, virtual tooth has been placed or extracted. The implant or 1 or 2 implants are almost where they need to be. And your workflow is more taken away from the clinician doing it, given to the staff. To a lot of these AI tasks of just a couple clicks are done. And the clinician could walk in and pay attention to the patient and focus in on them versus focusing on all the clicks and the things to do, so that everything's organized, possibly across multiple modalities for you, so that you are presented with the information you need, maybe even across multiple time points, so that you can say, okay, I can pay attention to this patient and I can share with them what my treatment goal could be. And it's there on screen, versus having to do so much work that you say, I'll just explain it without showing it, because your software could do it, but you're only taking advantage of 20%. We're taking that 80% and moving it over to this is more automated for you, so that you really will take advantage of those features.
That's super cool, man. Exciting times.
Yeah.
And definitely, I like the idea that you do it there and now sort of thing. And also another thing I find myself doing is, if I'm too busy and I can't show them there and now, you get the patient back, and I strongly believe in striking the iron while it's hot. People like to make emotional decisions, fast decisions. So having software, having workflow efficiency that allow you to do this, by all means, that would be amazing. And as you mentioned your IDS, I'll catch up with you for sure, man. That's exciting.
Yeah.
Is it like a Dexis booth or an Invista booth, or how's it working?
Yeah, I believe it'll be an Invista booth. We'll have a lot of that there. I don't have a lot of the details. We're working on it. We have active meetings of what our full messaging will be and what we can actually launch and release right there. But yeah, it's going to be exciting. And I hope to be sharing a lot more with you when we're out there.
Awesome, man. I'm really looking forward to it. And my final question for you, because you're about as passionate as I am about this. Have you seen anything in the market that excites you in digital dentistry? Is there something that you see out there that you're like, wow, this is really cool? Or is it, you nose down in the trenches working hard and you're really focusing on DTX Studio Clinic, which is probably the exciting thing, to be honest. But have you seen anything that people should keep an eye out for?
Even thinking back to some of your podcasts that you've done, and I've learned a lot from listening to those. I really enjoy them. It really helps me to keep my finger on the pulse of what's going on in digital dentistry. So thank you for that. When you look at 3D printing, I think it's very exciting. And I believe that I heard this from there, or I'd heard it before, and it was resonating, that it's not about the printer as much as it's about the materials. And when you look at some of these companies, we partner with Sprint Race, so they're coming out with a Midas now. I love that solution. It's about selling materials versus printers, if you think about it, because where you can go with that is really that future stuff. So that's one area that I get excited about, but I'm not an expert. I'm constantly trying to learn more about it, and it's getting easier to use. So those workflows were harder. You needed a person on staff, but that CAD CAM stuff is getting a little bit easier. And exocad is another one that's coming out to broader into the market and realizes some more of that needs to be accessible. So that's one area. A pitch for us, our new OP3D EX, which is in the United States. I'm just so excited about the solution because it's really got just simple, clean benefits. And just, our tenets are productivity, simplicity, and it's for you and your team. And this one just delivers that. The last thing that I think about is all of this AI. I just, in getting out there, I just did a study club last night. It's scary when you hear it. AI is not here to replace dentists. It can't do it. And when we go through these FDA processes or MDR processes to get all of this stuff done, we're not getting it to that, even trying to get it to that level. We're helping to optimize, standardize, and in some cases, delegate tasks from the dentist over to the staff members to free up that dental time to allow them to focus in on patients. So those are the things that excite me. Anything that works in that area to better explain and stop using cloud AI to get it across. It's so about these workflows and simple and productive.
I agree, man. And I have to say, it's like a really exciting time to be a dentist. I mean, in the past, I don't know, 6-7 decades, when was the last time dentistry was this exciting with this much change?
It's really wild, and it's moving so fast. For me, what I saw was 3D imaging coming in 2003 to 2008. It was just an exciting time of you had to learn about 3D imaging. Does it work? How do you use it in dentistry? What applications? Are there studies there? And now we're in this new realm of AI, and it's blowing me away. As an aside, I was in the Miami airport, and there were unassisted wheelchairs that were making this nice little sound, getting people from their gate to baggage claim across there. And then there were other ones that were empty, and they were going back to where they needed to be. I can't believe this is the time we're living in. It's so awesome.
And also there's those Ubers without a driver. You guys have them in the States. We don't have them in New Zealand. No chance anytime soon. But
not in California. Yeah, that's crazy.
Yeah. Oopsie, I did that classic mistake of a tourist saying California represents the whole US. Sorry, guys. Sorry. Yeah, no, you're totally right. It's mind-blowing. It is mind-blowing. And now we have MRI on the scene, Dentsply Sirona, saying, hey, and I feel like that's going to be, the MRI is really, really expensive. Probably not too dissimilar of the 3D X-rays of back in the day. But that's also going to be quite mind-blowing if that becomes, I wouldn't say mainstream, but, kind of like how CBCT is now.
Yeah, I was looking at MRI is one that's interesting, and there's some other technologies for getting the radiation out with cooler tubes that are exciting. I do think that's a little ways out before it'll hit a larger market. But you look at CBCTs, which started out, they were $250,000, and now you can get them, below $100,000 easily. Not down to 3,000 yet, like that intraoral scanner you saw. But
That'll be the days. That'll be the days.
yes.
Look, anyway, Jordan, again, a huge thank you, man. I know you're a super busy guy, and you just said you came from a study club. And so I really appreciate your time, your effort, and this great chat. I think it's been, I've enjoyed it a lot, and I'm sure people who are going to listen are going to enjoy it as well. Anyone who's coming to IDS, please check out the investor stand and go talk to Jordan. He's just a super nice guy, as you can see. So once again, a huge thank you, Jordan, for your time and for joining me on the podcast.
Hey, thank you so much. It's such a great opportunity to reach out and get to more people. And I do, likewise, so enjoy talking to you. So let's keep up more conversations, whether it's on this back channels. I learned so much from you. So thank you for all you do.
Likewise, my friend, my absolute pleasure. And that is another episode of the Digital Dentistry Decoded podcast, guys. Like and subscribe if you found this useful, if you got something out of it, and follow us on any of your platforms, apps. You'll find us on YouTube, Spotify, basically all the podcast apps. Subscribe to us, support us, and you will keep in the know of all things digital dentistry. Thanks for listening.